Okay, so we're going to review the various surgical pathologies that we see here, starting with hip dysplasia, which we actually see in both cats and dogs, although it is more prevalent in dogs. So, hip dysplasia is a developmental disease, meaning that um, you basically an animal that has hip dysplasia is it's something they're born with and they develop as they grow. It's also a genetic disease. So dogs that have hip dysplasia, their relatives also have that disease, and that's important to understand. When we're talking about hip dysplasia, what we're really talking about is hip joint laxity. Okay, so loose being bad, and there's varying degrees of severity that we see from not clinically detectable, where we have to take special x-rays to determine that an animal actually is dysplastic, and that would be done for instance for breeding purposes to kind of rule it out in an animal that's intended for breeding, through that spectrum up to the other end, where the animal's so severely clinically affected that the hip is essentially dislocated. And those are what we call luxoid hips, and kind of everything in between. So, what happens is when the hip joint is loose and the animal's ambulating, as the leg goes through the swing phase of the gait cycle, the hip can actually subluxate or partially dislocate. And as it comes around, when the dog or cat loads it, it'll traumatically reduce back into the socket. And that does damage to the cartilage and also causes inflammation that is what later leads to ongoing joint damage and arthritis, or what you call arthritis. So um, it's important to understand that all arthritis in our patients is secondary to an actual disease. So it's not a disease. You can't just have arthritis, and it is nothing to do with the animal's age. So just because an animal is older doesn't mean they have arthritis. You have to have something wrong with you. Or what we call arthritis is simply a radiographic finding that indicates the amount of damage that a patient has sustained to a joint. It is not reversible and not treatable, nor is it a diagnosis. So we want people to understand this, that there's no such thing as a treatment for arthritis. That's like me saying, hey, I have a way to unburn down your house. It's ridiculous. It doesn't make sense. So what does happen over time with these animals, though, is they have a state of chronic inflammation in their joint that causes chronic pathologic change. And so the secondary problem we see over time is degenerative joint disease that is kind of the other group of animals that we'll see for things like hip replacement. So our hip replacement cases tend to be two groups of animals. We have very young animals that are very severely affected, and their joint laxity is so bad that that causes lameness and gait issues that people will notice. And that's probably about 2/3 of our canine hip replacements. Um, and then the other third would be older dogs and cats, anywhere between, you know, 3 4 years of age out to, sometimes cats 14 13 14 year old cats, where we'll just see a lot of degenerative change, and they've started to develop a mobility problem that now needs treatment. Other pathologies we'll see that lead to hip surgery, particularly in cats. The most common one is a disease called physeal dysplasia, where they'll develop a fracture, like a spontaneous fracture of the femoral head. and that's because their growth plates are abnormal. The most common cause of that issue is spaying or neutering an animal prior to skeletal maturity. So these tend to be large male cats that were neutered when they were very young. And then between 1 and 2 years of age, their hip will spontaneously break. We also will see fractures of the femoral head in young dogs as well. Those are usually associated with trauma, like a hit by car. Those hip fractures are not really primarily repairable, although you can attempt to repair them with pins. That repair is usually not very successful. That animal will develop arthritic changes later in life. And then when they need a hip replacement, they have hardware in the way. They've already had surgery, and the complication rates associated with those scenarios are much higher. So we don't attempt to repair those fractures here. We will simply manage that animal medically until we can do a hip replacement on them as a final definitive surgery. Um, those are the primary surgical pathologies we see. There are some others we'll see in dogs called leg calf disease. We've seen a couple of dogs with cartilage disease called OCD, and there's kind of a variety of other less common pathologies. Okay, so now we're going to talk about surgical management of diseases of the hip. And these are going to be the things we talked about in the last segment. So there really, for the most part, are two main management strategies that are available surgically. Uh, Depending on the cause, if sometimes if a dog or a cat dislocates its hip, we will try and do primary repair on that. But that is an animal that suffered a trauma, a purely traumatic incident, and will do okay without a hip replacement or something like that. But if you're watching this video, that's probably not what's happened to your pet. So the first option is a historical procedure called an FHO, or femoral head ostectomy. And the way that works is you go into the hip joint and you take a sagittal saw and you cut off the femoral head and neck, throw it away, and then close the joint capsule over the hole. Now, that procedure is modeled after a human procedure that was first published in 1928. So we're talking like 100 years ago. It was published by a human surgeon at Oxford in England by the name of Guthrum Robert Girdlestone. And his idea was that at the time, in that era of history, they had a lot of problems with tuberculosis, particularly in the UK, and it would get into people's joints and basically destroy them. It would eat the joint. So his thinking was, if you simply cut off the femoral head and neck, you don't have a joint, and therefore you won't be painful. That's not actually what happened. So if you were unfortunate enough to have this procedure inflicted upon you, you would never be able to walk again without assistance. Assistance being a cane, a walker, or even a wheelchair. And so the outcomes were not real good. And in the early 1960s, when the first Richards hips became available, the human surgeons bailed out of this procedure like it was an airplane on fire. And so the standard of care very quickly became hip replacement. Around that time in 1958, 1960 is when the veterinarians showed up and said, let's try this in dogs. It doesn't work any better in dogs or cats. Now, the problem we have in the modern era is that our profession, mostly unwittingly, has been more or less lying to people about the outcomes associated with that procedure. If you look at the actual published literature and outcome data, there are a myriad of problems with that procedure. No animal that has an FHO, regardless of their size, will ever walk normally on that limb again. So it produces a gait abnormality in 100% of dogs and cats that have that procedure, which in my mind is not a hallmark of successful surgical management. Other issues associated with that procedure are limb shortening, persistent pain, muscle wasting, and these are all occurring in a very high percentage of these patients that have this problem. So in our practice, we refuse to offer that procedure starting about 10 or 12 years ago. And I am now aware of numerous other surgeons who just won't offer to do that procedure. So, why are we talking about this? In rare cases, and in the case of our practice, this is extremely rare. If you had to remove the hip implants, the most common reason for that would be an unmanageable implant infection. You would, by default, end up with an FHO. And what is true is that if we're selecting our cases properly and that patient ended up with that procedure, to be fair, they would probably be better off than they were with whatever the initial problem was that caused them to have a hip replacement in the first place. So, of course, the second surgical option, which is what we offer in our practice, is total hip replacement. And so that involves starting with an FHO because you need to get the femoral head and neck out of the way. And then you're going to implant a prosthetic device that replaces the function of the hip. Okay, so now that I have my props here, most hip replacements are a 3-component system. You have a cup that replaces the socket, and then you have a stem that goes down the middle of the femur, and then the stem has a neck on it that you put a head on. And when you put this back together, you have a ball and socket joint again. So in principle, it's very, very simple. So there's some issues potentially with doing this that we need to make people aware of to kind of keep them out of trouble. So we have 2 systems that are employed to do this. There are cemented implants, which are rarely used, and I actually kind of stopped going through some of this issues with cement because it's pretty historical at this point. We'll cement implants in maybe once or twice a year. And the reason we've tried to move away from this is there is potential for some longer term complications like implant loosening that we want to get away from, especially in small animals like cats and small dogs. And also the infection rates with cement are 4 times higher than they are with cementless implants. And so we rarely will employ cement unless we really kind of have to use it for technical reasons. So the implant system that 99% of our patients get are press fit implants or biological ingrowth or on growth implants. The way these work is a little bit different than cement. So initial implant stability in the dog or cat is by what we call press fit. And what that means is we have reamers or shaped files called broaches that we use to prep the bed for the implant. And those broaches and reamers are exactly the same shape as the implant, but they're just a tiny little bit smaller. And so once we have the recipient bed prepped, what we do is we line the implant up over the hole, and then basically we smash it in with a great big hammer until it's stuck there. So I mean, there's probably nicer ways to express that, but that's the reality is we just jam it in so it can't move. And then long-term stability is by bone ingrowth. So the ingrowth surfaces of these implants are a titanium mesh lattice that's actually, these are 3D printed. And after several weeks, that dog or cat's bone is going to grow right into that implant. Once these implants are osteointegrated, if you want them back, you better want them back desperately because you will have an ocean of pain trying to get these out. They really are intended to stay in the animal for their entire life. So when we're implanting the cup, it's very, very important that we get the three-dimensional orientation correct in the patient. So the reason being, one of the things that kind of holds this together, this is what we call an unconstrained implant system. So what that means is they're not physically linked together. What holds your hip together is, among other things, something called concavity compression. So basically, the fact that these fit together, and when the animal walks on it, it presses them into each other is kind of what holds it there. So the 3D orientation of these implants is really important to make that work. And most people are pretty familiar with 3D coordinate systems. So, you know, if you're into flying, you've got roll, pitch, and yaw. If you're into math, you've got X, Y, and Z, etc. So our 3D system for cups is open and closed, anti and retroversion, and then inclination and declination. So we've got to be pretty, precise in all three planes to get this right. If I implant a cup that's, say, too open and it's inverted, well, it'll take nothing for that to come apart as soon as the animal walks on it. So fortunately, we have a massive amount of experience doing this, and our cups are usually like pretty close to perfect. Um, so we don't tend to have orientation problems. But if you did and the hip dislocated, that's not a pop it back in scenario. That's a you're going back to surgery to deal with this problem. And so that's kind of one big thing that we need people to understand when we do joint replacement surgeries of this nature. If you have a complication, there's a good chance it's going to have to be repaired surgically. And it may need more than one surgery to fix this. And a lot of people are very familiar with this scenario in humans where, they may know somebody who had a problem, for instance, with a knee replacement, and there were several surgeries to correct that. So it's very, very important that when we're giving discharge instructions, the primary reason for those instructions is to make sure that we don't have complications, because there are other ways to dislocate a hip replacement besides orientation. For instance, if we have a slip and fall on the ice and the dog frog legs, that can actually jack the hip out of the cup. And when they stand back up and rotate the leg around, now the prosthesis is dislocated. So sometimes the manner in which the animal sleeps or moves around can do it, although that's pretty uncommon. If a luxation occurs, that would be a surgical correction to fix that. So we want to not have to do that. We're real careful with how we put implants in and then how we handle these animals afterwards. So the other thing we worry about over time with these guys is the potential for implant wear. The liner of the cup is polyethylene, which is a type of plastic you know of as vapor barrier, like the stuff your house is wrapped in. Now, this is extremely expensive vapor barrier that has had some other chemistry done to it, so that modern implants are actually extremely wear resistant. They really are meant to last the lifetime of whatever animal they're put in, whether it's a human or a cat or a dog. There are circumstances, though, where we can get accelerated polywear. And if that were to occur, we need to catch that before it turns into something catastrophic, and we can simply go and do a liner exchange to kind of get things back on track, which is one reason for long-term monitoring. So the other thing we want people to be aware of, kind of what they're getting into with these, we need to, monitor these animals in the long term for a polywear and implant loosening, which means that once a year, anytime I put a joint replacement in an animal, whether it's a hip replacement or a knee or an elbow replacement, I'm going to have a lifetime relationship with that client and patient, because once a year we need to check these guys out, get some x-rays, tech scan data, physical exam, and just make sure that everything is just doing okay, exactly as they do in people. When people have a joint replacement, they get rechecked for the same things. So those are some of the issues that we worry about with the cup. There's some others, and they're covered in the handout that we provide as well. With respect to the stem, we're still worried about those things, and the other thing we're worried about with both implants are implant infections. That's really the big complication that is potentially scary, because it could get your implants removed. The other complications we encounter are all fixable. They may or may not require surgical intervention, but we can fix them and have a successful outcome. Now, the likelihood of implant infection is very low. In our practice, it's around 1%. But when it occurs, it can be quite serious. So we actually have developed and published protocols on how to treat these arthroscopically and retain the implants quite successfully. So nowadays, when we do run into an infection, about 80% of the time we can actually treat it and keep the implants in the dog, thankfully. So we're very proud of that work that was done in this hospital, and is now part of the standard of care in the profession for treating these. So yeah, we're worried about all that stuff. Now, the other thing we're worried about with the stem, when we're prepping the femur to put this stem in, we have these files that we basically drive into the femur that remove bone as they go, and they make this shape so that we can press fit the stem in the femur and have it stick. The problem is, you can actually break the femur when you're doing this. You can fissure it, which means essentially you've split it like a log. And we've done that. It's a risk of doing hip replacement. It doesn't happen often, but it happens. It's a once or twice a year thing. We do a lot of hips here, so the probability of issues goes up when you do something, very, very frequently. Now, that doesn't mean that your hip replacement is over, it's done for, but it means there's going to be some language involved in the OR, and we're going to wire that femur back up and keep going. And now, at least in our database, thankfully, we've never actually had a subsequent complication from a femur being fissured. It can occur, and so we want to try and avoid that, because it does increase the likelihood of other complications like infections and femoral fractures and stuff like that. The other way you can break a femur is postoperatively. So when we put a hip replacement in an animal, we're going to acutely change how their femur experiences load. We're going to, change the biomechanics completely, and the bone is not really, remodeled for that change. Now, it will, dissipate the strain we put under it over time, but it takes about 6 to 8 weeks for that bone to remodel and unload that strain we've induced. If that animal applies a supraphysiologic load to the femur, say by running off leash before that bone is remodeled, the bone is going to acutely unload the strain, much the same way a NASCAR is designed to unload strain when it hits another car. It explodes. So one of the reasons for the restrictions we have on these dogs is so they don't shatter their femur, running around after a squirrel. So that has occurred, and it's not a situation you want to create. So when we're going over these post-operative restrictions, it's to make sure we have a successful outcome and that the owner or the dog doesn't do bad things. So again, those are some of the complications. The real big ones that we worry about, like I said, there's others. They're covered in the handout. We want people to understand this stuff so they understand why they have to follow these rules post-op and what the consequences of not doing that are. The bottom line is that those complications only occur in a small percentage of patients. Our complication rate with hip replacement here is about 4.6%. And not all of those complications were catastrophic and resulted in more surgery or the loss of the prosthesis. The success rate with this procedure in our practice is over 99%, which translates into, yeah, a few animals had some complications, but almost all of them were resolved successfully, and those dogs and cats went on to have great outcomes. Because the expected outcome from this is that it will restore your pet to normal, as if they never had a problem in the first place. They'll, if you put them on the Zebras and we measure the load on an unaffected limb versus a limb that's had a joint replacement, the computer cannot tell the difference. And frankly, when I see these animals for their follow-up rechecks year after year, I would never know they had a hip replacement just seeing them walk down the street. So that's our goal in treating these animals in this manner.